So a lot of places and a lot of clinics freeze eggs today. But of course, no one's ever gotten pregnant by freezing an egg. The critical steps in the process to have a baby are to freeze the eggs successfully, but years later, when you want to use the eggs, to be able to thaw the eggs successfully, meaning they survive the thawing. But after that, there's much more. The egg then has to be fertilized. It has to be cultured or grown in a laboratory for approximately 5 days to allow it to go from a single cell fertilized egg to a 60-cell blastocyst stage embryo. And at that point, that 5-day-old 60-cell embryo would have to be transferred back into the uterus and be healthy and unstressed to lead to a successful pregnancy. So these days, when women think about egg freezing, they're thinking about the very first step in a multi-step process. And if the same clinic that freezes their eggs can't thaw them successfully, can't fertilize them successfully, can't culture them for 5 days without stressing the embryos, they won't end up with a baby, even though their eggs were frozen. So it's important for women to understand all the aspects of this process have to be done at a high level for them to realize a positive outcome at the end of the day, which is actually to get a baby from these eggs that they've frozen, and to get a baby from all their hard work and, of course, the money they spend to invest in their future. So it's important for each patient to ask their clinic not how many times have you frozen eggs, but how many times have you thawed eggs, how many survive, how many turn into healthy embryos, and how many live births have you had from this process? Because I want to know when I come back to you in 2 or 5 or 10 years that I can have a live birth.